Okay, hi everybody. Welcome to today's Wednesday Lunch and Learn. I am Teresa Isabel, host of this Facebook group that we're streaming into, and we're on YouTube too. It is the Moving and Reshaping Club for Women 40 Plus. And what do we do here? Well, I help women, who are done with their stiff, achy, stuck behind screens bodies and who are ready to get in shape and feel pain-free without the sweat, strain, or time suck of traditional and typical exercise, because I want you to look amazing, feel amazing, and age audaciously so that you can show up every day and just crush your professional and personal goals. That is what we are all about here. And a big part of that is learning how to manage our menopause and specifically manage what is going on in terms of intimacy, which we're using the word as an innuendo so that Facebook doesn't flag us too much for using the word sex, but that is what we are talking about. And we have with us today Teresa Isabel Dias, and she is a North American Menopause Society Certified Menopause Practitioner. Hello, Isabel. Isabel is going to tell you how to get your mojo back and what to do about the dryness and pain. So thank you so much for coming to chat to us today.
Thank you so much for bringing the sex subject to this group, because if there's anything even more taboo than menopause, is midlife sexual health and well-being. So thank you for raising this topic, for putting it out here, for airing it, for talking about it, and hopefully we'll have comments and questions and we can help women deal with this.
Absolutely. This is private. If you're watching on YouTube, there are no comments. If you want to ask Teresa a question, if you're watching live or on the replay, come and join the group. Find the post, go #replay and tag Teresa and she will answer your question. And if you're watching live, I am going to put Teresa on the screen now and I will be watching for comments and questions. All right, so let me hand over to you, Teresa.
Thank you so much. So I can still see you, but that's fine. Everybody else can see me. I'm just going to start by sharing a graphic, because I don't assume that all of us know our reproductive system as well as I do, because I've been studying this since high school. So I'm going to share a slide just so we all know what we're talking about here. So can you see this, Stacy? Tracy?
No, I can't.
Okay, let me see. Let me try again. Let me see. Sorry. I gotta press. Maybe I should put my glasses on. There you go. Window, share. Okay, now you can see it.
Yes, now I can see it.
All right, so these white things on this image are the ovaries. And the ovaries have eggs, and we start releasing eggs in puberty. Everyone born with ovaries will start releasing one egg, usually out every month in puberty. And the ovary travels down that orange tube, that is a fallopian tube, down to the big round thing in the middle, which represents the uterus. If we don't get pregnant, the uterus sheds the lining and we have a period. The first day of a period is the first day of our cycle. Usually our cycles last 28 to 31 days. And as the egg travels down from the ovary to the uterus, also called womb by some people in the world, the egg releases estrogen. So that's how we make estrogen primarily. When we get to perimenopause, this the release of egg is not as predictable, is not as regular. Some months, some women don't produce an egg at all. Therefore, they will not have any production of estrogen. Some of the months we may even release more than one egg, and sometimes that produces more than usual amounts of estrogen, and some of us feel breast pain during some months could be due to this.
Mm-hmm.
Also reminding you that because we still release eggs, albeit not predictably and not as regularly, if you are sexually active and you don't want to become pregnant, you must make sure that you use contraception during perimenopause and for at least 12 months after your last menstrual period.
Right.
So
maybe we can just define what menopause is.
exactly. I was going to go there next. Thank you so much.
Okay.
So perimenopause is, so menopause is the end of ovulation, the end of menstruation. So the eggs.
Is this a slide here? Because the screen is blank.
Oh, sorry. No, I don't have a slide. Can you see me now?
Yes.
So perimenopause are the years leading up to menopause. And menopause is nothing miraculous or anything mean or bad or disease-like. It's just the end of ovarian function. So the ovaries no longer produce an egg. So we don't get that estrogen from the egg traveling from the ovary to the uterus. But because I said some months you don't ovulate and you may skip periods, it's hard to tell when the last menstrual period is. So we look back. Menopause is defined when a woman hasn't had 12 consecutive periods. 12 months of no periods equals menopause. Celebrate. After that, you are in postmenopause.
So menopause is 1 day, right?
Menopause is 1 day, exactly. After that, you're in postmenopause for the rest of your life. The age of menopause in North America is usually between 45 and 55. And average is 51. Those women who have menopause under the age of 40 are said to have premature menopause. It can be spontaneous or it can be induced. And induced menopause can be caused by removal of the ovaries, for example, or it can be caused by some medical treatments. It's a fact that some chemotherapy and some radiation therapies for certain cancers, like some breast cancers or cervical cancers, can damage the ovaries and they stop working, and therefore you are put into induced menopause.
Right.
If menopause happens before the age of 40, it has more consequences in long term because estrogen has a protective effect. It's a woman's best friend. Forget about diamonds. Estrogen is our best friend. It protects us from cardiovascular disease, from osteoporosis, from diabetes, from dementia. So it's important to, pardon me, if you are very young at the age of menopause, please consult your doctor to reduce the risk of diseases such as osteoporosis and cardiovascular disease or heart attacks. And so perimenopause are the years leading up to menopause. And I said, if menopause happens,
interesting here, if I can just interject for a minute, we're calling this intimacy in menopause, and we're talking about dryness and pain. And I know that many people think, oh, that's something that happens post-menopause. Okay.
Exactly.
Can you talk a little bit about that?
Exactly. I was getting there. So if you remember that I said menopause can start at 45. If perimenopause lasts 3 to 6 years, 45 minus 6 is 39. Some women start experiencing perimenopause and decreased levels of estrogen at that time. What happens then when estrogen estrogen levels is low? Let me show you another image to give you a better idea of what I'm talking about. So bear with me while I get my technology here. Oops. Share. Can you see this, Tracy?
Yes.
Okay, so on the left, we have vaginal environment before menopause. So we have the ovary, the fallopian tubes, the uterus, and then the tube that comes down from the uterus, vertical down, is the vagina. Also called the birth canal, because if you have a baby, that's usually how the baby is born, through the vagina. As you can see on the image on the left, there are pleats or rugae, these these folds in the vaginal walls. There's a thick lining of it. And all this is due to estrogen because it's the most predominant female hormone. So it acts in all female organs, like all these organs we see here, ovaries, uterus, and vagina. When estrogen goes, things start to get, the word atrophy sounds bad, but that's how it describes. Everything kind of gets smaller. So as you can see on the right, it's the uterus and the vagina after menopause or when there's lack of estrogen. So the folds in the vagina go away. The thickness of the lining gets much thinner. The lining gets thinner, and those the cells responsible for producing lubrication during sexual arousal are in those thick layers. Once the layer gets thinner, there's less lubrication because there's less cells producing lubrication. You can also imagine this. I like to talk about this visual. On the left-hand side, when there's lots of estrogen, the vagina behaves like a pleated skirt. You know, when you wear a pleated skirt, you can sit and it gives way. You can do whatever you want. You can even do the splits if you want in a pleated skirt. On the right-hand side, when estrogen levels are lower, it's like a tight mini skirt. There's not a whole lot of give.
Right. Like a pencil skirt, yeah.
A pencil skirt. So that makes penetration sex painful because there's less lubrication, there's less folds, the vagina shrinks, and it gets smaller. So that's physiologically what happens to our reproductive system when estrogen levels decline. Okay. Can you see me again?
Yes, yes.
All right. Any questions so far?
So yeah, and let us know in the comments. Let me know if you're watching live. Give us some hearts, give us some love, say hi, tell us where you're from, because the more you comment in the comments, whoever is watching, the more Facebook is going to show this to other people in the group. So please put your comments, put your questions. So does this happen to every woman going through perimenopause and menopause? What is the prevalence, and why do so few women talk about it or even try and get relief?
Good, very good question as always. So yes, it happens to all women. Sometimes it happens only in postmenopause. Sometimes it happens during perimenopause. Hot flashes affect about 80% of women, and they tend to get better with time since menopause. This problem gets worse with years without estrogen. So the longer we go without estrogen, the more accentuated are the shrinking, the shrinking of the vaginal walls, the shrinking of the vaginal length, the reduction in folds, and so on. So it's a problem that does not go away.
Right. I think that is really, really important to stress, right?
Yes, it doesn't go away, but there's a lot of, yes, it does not, there's a lot of ways to deal with this, and we don't have to suffer. So there are studies, there's some research done that it may affect more than 80% of women, but about only 4% receive treatment because they don't complain about it, because the doctors don't bring it up during our annual consultations.
Why don't they bring it up? Why don't the doctors bring it up?
Because most doctors are not well educated about menopause, and this is not an issue that it's top of mind.
Are you saying like even your gynecologist wouldn't bring it up?
It may not. It may not. Yeah. That's why I tell all my clients, I tell, if you are, and it's not only a problem for women who are sexually active, it can make anyone very uncomfortable. I know women who stop riding their bicycles because it's very uncomfortable. I know women who spend a lot of money in new bicycle shorts because they thought the problem was the sitting and the attire and all that. I know women who cannot wear tight pants. I know women who cannot sit for long periods of time and they have a desk job and they need to sit for 8 hours. So it's not a problem that affects only sexually active women.
Right.
And that's important to emphasize because,
Very important.
but it's not only the only medical condition in this area that affects women in menopause. So first rule is, if it's not feeling right, go to the doctor and get a diagnosis of whatever it is. It could be a dermatological condition.
Mm-hmm.
It could be a vaginal infection. It could be a yeast infection. It could be a whole lot of things. So the first thing you need to know is, why is it not feeling right? And when you ask the doctor, you emphasize, doctor, I'm in perimenopause. I've been skipping periods. Could this be a sign that my vagina is getting less estrogen effect because I have less estrogen? Is this something that can be fixed with a moisturizer, lubricant, whatever? Or is it a medical condition that I need another treatment? Because if you don't bring this up to the doctor, they may not tell you anything about it. So that's why one of my favorite things to do is be a woman's health advocate. We have to ask the doctors, could this be that?
Mm-hmm.
Let's put all the dots together. Let's figure it out. Okay, I'm skipping periods. I'm having perimenopause symptoms. All of a sudden, my down there doesn't feel so good. Maybe it's due to lack of estrogen. Maybe it's due to lower levels of estrogen, or maybe not. But let's ask the doctor. So never assume anything, and don't start using products off the shelf because it's a very sensitive area. And don't use douches because they are not good. There's a lot of things that live in a vagina that are important for its health. It does not need to be washed. It's a self-cleaning oven. It has its own pH. You know, the pH of a swimming pool is an important thing. The vaginal pH is very important. If we start putting douches and stuff inside, we're going to wash away all the good bacteria and the good organisms that live there, and make it an environment that is adequate for the area. So we don't want to put things there that don't belong there. But if it's not feeling right, check it out.
Right. Yeah. Yeah. And why do you think so few women do talk about it or do ask for relief?
Well, you just said that at the beginning.
Yeah.
Facebook is going to flag us as being some awful people because we're talking about sex. I ask my clients, my patients too, why can we talk freely about runny noses and we cannot talk with the same comfort about vaginal dryness? It's still a part of our body. It's still, sex is part of being a human being. It's an animal thing. And we don't have to stop having sex when we don't have estrogen, because sex is not just for reproduction.
Right.
There's a lot of well-being that comes from being sexually active.
Absolutely.
And
right. And that brings us to our next topic. That brings us to the next question, which is if you can talk a little bit how, and just to say that Teresa, you can find her at menopause education, menopauseed.com. .org, sorry, menopauseed.org. And Teresa consults with people all around the world, giving you, well, you can talk about that a little bit as well, but in your practice with your clients, what is happening in terms of a woman's self-esteem and in her intimate relations, and how can this affect your relationships?
Exactly. So in fact, there are many studies done in Europe, in the United States, that looked at the impact of vaginal dryness in marriages, intimate relationships, women's self-esteem, all that has been studied. It's a fact. We know that. And that's why now we have good treatments to treat this. So in my practice, I see a lot of women avoiding all intimacy because they don't want to end up having sex. So they don't cuddle with their husbands on a sofa anymore, because if they start kissing and hugging, they're afraid they're going to end up having sex. And sex hurts. And who the hell wants to have sex if it hurts, right? That I understand. But the problem is to avoid that, we start avoiding all intimacy. So, and sometimes we know that there's a knowledge gap about menopause. So a lot of women don't even know why they're going through these symptoms. Why do they have these things? They don't associate it to menopause. They don't know what's going on. They just know it doesn't feel good anymore. But they also don't talk to their husbands or their partners, their sexual partners about it. So if the women don't know what's going on and the partner doesn't know what's going on and the woman starts avoiding intimacy, I once told a client of mine, what do you think he's thinking about? She doesn't like me anymore. I'm not attractive anymore. Maybe she has someone else. There's so many layers to uncover when intimacy in a couple's life starts changing to in this way because there's lack of communication.
Mm-hmm.
But you can't blame the woman because sometimes they don't know what's going on. So what I tell, first thing is go to the doctor and see what's going on. Second thing is if you have a partner that's being affected by your change in intimacy habits, be honest, be open, be frank. Just say, it hurts. And I don't know any partner who wants to hurt you. So they're not going to force, your lover is not going to force you to do something that it's not comfortable for you. But maybe together you can find treatments, relief, other ways to be intimate and not give up completely on intimacy just because you don't want to go all the way.
Right. Yeah, absolutely. Absolutely. So let's talk about treatment options.
Yes. So first line treatment options are non-hormonal choices. So there are two types of over-the-counter products you can use. One is some are moisturizers and some are lubricants. If you remember from that graphic, the lining shrinks and moisture and lubrication is reduced. If you want to use a regular moisturizer to bring moisture to the area all the time, you use a moisturizer and you use it according to the instructions. Some are twice a week, some are 3 times, 5 times every day, whatever.
And are those over-the-counter moisturizers?
Yes, over-the-counter moisturizers.
You can find them in the pharmacy.
Yes, the best ones contain hyaluronic acid, which is a big word. But I'll write it in the Facebook afterwards because hyaluronic acid is supposed to draw moisture to the tissues where you put it. So there are gels and there are ovules that do that. So if you're not sexually active, this is the first line of treatment. If you are sexually active, you can use a moisturizer, and then you can use during sexual activity a lubricant that adds lubrication that you're no longer able to produce because the layer of cells in the vagina is thinner and is not producing natural lubrication. Lubricants come in many components: water-based, oil-based, and silicone. With water-based lubricants, you have to worry about the pH of the product. If it has too many ingredients added to the water to make it thick and to make it easy to apply. So I don't like water-based lubricants because most of them are irritating. They burn, they hurt, they don't fix the problem. They can actually make the problem worse. So that leaves us with oil-based or silicone-based. They're both good. We don't have to worry about pH with those because they don't contain water. I prefer silicone-based because it offers very long glide, does not stain, does not smell, washes nicely, and leaves a feeling to the area that I equate with rose petal kind of smoothness. Can you imagine when you touch a rose petal? Yeah. That kind of smoothness. When you use a silicone and you wash it afterwards, you can still feel that smoothness. So I like that one.
Which brand do you recommend in the silicone?
My favorite, and I've tried them all. Trust me, I've been my own guinea pig. The one I prefer, and I don't use anything anymore, is Uber Lube. Uber Lube, as in Uber Lube.
Okay.
It's made in Germany. It's sold online. I can put the link on the
Yeah,
Facebook
please
afterwards as
do.
well.
Please do.
And
So
it's
that's
fantastic.
sorry. So that's the lubricant. Is there, if we can just go back for a second, I know you want to talk about the oil, but is there a brand of vaginal moisturizer that you recommend?
Anything with hyaluronic acid,
Okay.
mainly that only ingredient, not much else, is good.
Mhm.
In Canada, I don't know of products in other parts of the country, but in Canada, the best one is an ovule that is sold without a prescription, but it's behind the counter. So you have to ask the pharmacist, and it's called Repagyn,
Okay.
Repagyn. It's a very good product. I don't know of
Mhm.
anyone who's had an allergic reaction to it. But again, we don't know sometimes if we have a sensitivity until we use it. So if you're using a gel or a cream, you can apply it on the inside of your arm first. If it is an ovule, it's harder to do. But these products are very safe.
What is an ovule, if you can just clarify for us?
Ovule, it's, you know what a suppository is? This is the
Mhm.
same thing. It's a solid ovule. It's like a suppository, but you insert it in your
Okay.
vagina, and it's only twice a week.
Okay, amazing. All right. So you were talking about the silicone lubricant, and then we were going to talk about the oil base.
Oil. So there's several oil lubricants. In the UK, they make a wonderful product called Yes, and it is an oil-based lubricant. It's my second favorite, is very good as well. It's a little more sticky and more messy than the silicone, and that's why I prefer now the silicone, but it's a very good product as well. It's made with the smallest minimum amount of ingredients, so it doesn't cause irritation and burning and any of that. So that's my second. A lot of my clients ask, why can't I use olive oil, which is a natural product, or coconut oil, which is also a natural product? I said you can. The problem is sometimes with those products, it's easier to get yeast infections. So if you've been using those kitchen oils for a long time and you're fine and it's not causing problem, don't go spending money on something else. If it's working for you with no problems, continue using. But if you're asking me what to use, because of the increased risk for yeast infections, I would not recommend using a kitchen oil. I would go straight into a silicone or an oil-based lubricant.
And are there some people for whom because these are the non-hormonal treatments that we're
That's
talking
right.
about. So are there some people for whom the non-hormonal treatments are not enough?
Yes. So it may start being very useful, very beneficial, and you're enjoying it. And as we mentioned, this vaginal dryness tends to get worse with time since menopause. So maybe 2 or 3 years after menopause, you can still use these products and you have relief and it's pleasurable and all that. But then a few months down the road, the same products don't offer the same benefit. It's because lack of estrogen
Mhm.
keeps affecting the area, as we saw. So at that time, if there are no indications for use of low dose vaginal estrogen, that is a good therapy. Now, we cannot confuse these products that are low dose vaginally applied with the typical menopause hormone therapy that we take for hot flashes. These are two completely different products. For hot flashes, we either take a pill or we apply a patch, and it goes through our whole body and it takes care of the hot flashes and the night sweats, and it has to be excreted and it has possible side effects and all that. What we're talking about for this, the treatment of vaginal dryness, is low dose vaginally applied estrogen. And there are, again, ovules, there are creams, there are different types of things. In different countries, probably there are called different things, but estradiol vaginal cream would be the best choice because estradiol is the molecule that is most chemically similar to the estrogen we produced in premenopause. So it's considered a bioidentical because it is chemically similar to the estrogen we produced. So estradiol vaginal cream, it's available with a prescription in the United States. In Canada, it isn't, but we can have get a prescription from the doctor and go to a compounding pharmacy, a certified compounding pharmacy, just not anyone, but a certified compounding pharmacy to make this gel, this cream that we can use vaginally. Now, women ask, which one should I use? This is how I screen for an ovule versus a cream. Is it itchy outside? If it is, it's probably because of dryness. Then you can't apply an ovule outside. You better apply a cream. If it is also painful with penetration, it could mean that the vaginal opening is shrinking and it's making it less elastic. So if you have a cream, you can apply it to the opening of the vagina and massage that muscle to make it more flexible, more elastic. Speaking of that, I don't want to, I'll talk about other prescription medications that are finally available in Canada, but talking about opening and shrinking of the opening. There's a very good way of dealing with that is non-pharmacological, and that is to see, and I recommend every woman goes at least once to a pelvic floor specialist, a physiotherapist that is trained in pelvic floor health, because there are a lot of pelvic floor issues in some menopausal women that can be solved with dilators, for example. If we have stress, if we are afraid that we're going to be hurting when we have sex, the muscles can start shrinking and not relaxing properly. So these pelvic floor therapists can help women with that issue by using dilators that increasingly open the vagina a little more, and the sizes get bigger as you train your muscles to relax and to feel better, easier to relax without having to use a hormone therapy. You can use a lubricant along with this.
Right. And we have some wonderful pelvic floor physiotherapists in the Facebook group. So if anybody would like a referral or would like a contact, just PM me or PM Teresa. I also have contacts around the world, so just let me know.
We should all go to pelvic floor therapist at least once, just to see how the health of our pelvic floor is and what's impacting what, because our body is a huge environment. It's a huge, we have to approach everything holistically. Just because it hurts, and you know this better than anyone, just because it hurts on that side, it doesn't mean it's coming from there. Right. It could be coming from somewhere else. Absolutely. So yes, my vagina hurts when I have sex. It might not be anything to do with vaginal dryness and lack of estrogen. It may have everything to do with a tight pelvic floor. So check with a doctor, check with a pelvic floor specialist.
Right.
And now in Canada, finally, it's been available in the States for a long, long time. And in Canada, finally, we have oral medications to treat vaginal dryness. So instead of using locally applied estrogen, there's a pill that people can take. And also there's, instead of estrogen, there's an ovule of DHEA, not to be confused with a DHEA we buy over the counter. It's an ovule. It was a product researched and manufactured in Montreal that was approved in the United States first, and now it's available in Canada. That has the same effect as the vaginal estrogen, but it's a newer product, so there's less data about it. So we know a lot more about low dose vaginal estrogen than we do of any other product. So as you can see, there are lots of options for women to use and not continuous suffering.
Mm-hmm. Amazing. Thank you. Thank you. That is good news for everybody to hear, I'm sure. So maybe tell us a bit about what you offer women as a North American Menopause Society certified menopause practitioner. Like, what is that? What do you do and how do you help women?
So as we touched a little bit before, there's a lack of training in the medical schools and pharmacy schools for that matter. And a lot of healthcare providers are not comfortable because they haven't received the proper training to discuss menopause care with women. So that leaves us all scrambling for, where do I go? Who knows about this? Where am I going to get the answers to my questions? And how am I going to have my problem fixed? So the North American Menopause Society is in the United States, and they offer a certification for healthcare providers who want to deepen their knowledge and their education regarding menopause. So when I was in my perimenopause, my son asked me if I was bipolar because my mood swings were very extreme. I did my research online, and in those days, I could tell what was being disguised as education, but was sales pitch from what was really good information. There was not as much good information then as there is now. This was 10 years ago. So I found, luckily, the North American Menopause Society, which has information for women and for healthcare providers. I learned what I needed to learn to understand what I was going through and to understand this.
And we should probably also just tell people that you are a pharmacist.
Yes, I am a pharmacist.
Some understanding.
Yes, I've been in community pharmacy for 28 years. So I found out that, okay, now that I know all this about me, there's a lot of women out there who don't know this, and I would like to explain to them and talk to them and educate them. So I became a certified menopause practitioner. I studied for a whole year because I was also suffering from brain fog during perimenopause. And then I wrote the exam and I became certified. And I have to keep my certification every year. And there's conferences and courses that we need to keep on taking because, thank God, that everything is changing fast. So there's new treatments in the pipeline to treat hot flashes other than hormone therapy and so on. So it's an exciting time to be in this field. And there are probably hundreds of NCMP, North American Menopause Society, certified menopause practitioners in the States. There's about 90 in Canada, and there are lots of others throughout the world. So if a woman watching this wants to know, I do all my work online, so I can reach anyone. But if someone wants to see in my country, is there anyone who is an NCMP? Go on the menopause.org website. It's the NAM's website, and you can find an NCMP, and you can see who in your country is certified and who is taking new patients. Because you can get this way, you know that you are dealing with someone who had studied, learned, has a deep understanding of the menopause change.
Fantastic. Amazing. Well, thank you so much for coming to speak to us. I know a lot of people will be watching this on the replay. So if you have any questions, please just pop them in the chat, hashtag replay, and tag Teresa or tag me. Because this is a taboo subject, but we don't need to suffer. And the most important thing is, it's not the kind of thing that you're like, oh, if I just ignore it, it will go away. No. If you just ignore it, it's probably going to get worse. And importantly, you do not need to be suffering, and your relationships do not need to be suffering. So maybe just tell people one last time how they can get hold of you, Teresa.
So best way to get hold of me is to visit my website, menopauseed.org. So it's menopause with a D at the end.org. I love doing discovery calls and helping women figure out what's going on. I want mainly to provide education and to reduce fear, because there's a lot of fear, there's a lot of negativity related to menopause, and it does not have to be like that. It can be a positive, P-A-U-S-E,
I
positive
love that.
time in our lives. And that's what I do. So I do one-on-one consultations, and I also do lunch and learns for organizations because menopause in the workplace should be normalized, just like we normalize pregnancy and are demystifying mental health. We should do the same with menopause.
Absolutely.
And menopause is the glass ceiling no one is talking about. So if you have a group of women, or if you work in a company, you're in charge of, or can contact someone who's in charge of health and wellness, or equity, diversity, and inclusion, or whatever it is, department it is, give them my website and let's have a lunch and learn in the workplace, because women are suffering and quitting their jobs, and we shouldn't allow that.
Absolutely. Absolutely. Well, thank you so much for coming to join us on this lunch and learn. I really appreciate it. As I like to say, we've learned, now it's time for lunch. And have a wonderful, wonderful rest of your day. Thank you for coming.
Thank you, and all the best to everyone.